This is Healthcare Now Radio's Trending Now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I'm your host, Shahid Shah. Today, we're really excited to have Gary Jessee, Senior Vice President of National Consulting at Sellers Dorsey, joining us. What's trending now and what Gary and I will discuss are the innovations and strategies transforming digital health and Medicaid's role in advancing health equity. We often talk a lot about commercial insurance. We've talked about a lot about the provider side, but this is going to be super interesting because a lot of mental health work that is being done these days in the equity side especially is being done by Medicaid. So having an expert like Gary always makes my day there. So we're going to look closely at mental health services, telehealth for rural communities, community-based care, substance abuse initiatives, and a whole bunch of topics around social determinants of health, which, you know, as for those of you that have listened to our radio show before, you know that I'm not a big fan of social determinants of health because I just think those are life determinants. They're not really determinants of health as much as they are just determinants of life and how well you live it. So whether you're talking about finance, whether you're talking about social determinants of health, it's all just life care, right? And so that's what we're going to talk about today. So with that, Gary, tell us a little bit about yourself, and then we'll jump in our first few questions.
Sure. So I'm Gary Jessee, as you described. I lead the national consulting practice at Sellers Dorsey. Been with the firm 7 years. We specialize in Medicaid. But before that, spent several decades in state government in Texas, had the privilege of leading the health and human service system, served in various roles and capacities, but spent time as a Medicaid director and spent time as the deputy executive commissioner over all of our health and human service benefits.
Very cool. I know you've got that expertise and experience, so it's always good when those two get together. So given that extensive experience in Medicaid, I'm sure you've seen lots of ways that the policy side and day-to-day working side really impacts communities. What are some unobvious or lesser known ways that Medicaid programs are really making a difference in mental health, especially where traditional healthcare models have not really kept up?
Yeah, I think, you know, some of your earlier comments, I think Medicaid is a very, very important healthcare system in this country. And when you think about behavioral health needs, you're talking about a group of individuals that might have other complex health needs. So you have co-occurring conditions. You have lots of individuals with intellectual and developmental disabilities that also have a diagnosis of a behavioral health or mental health issue. And I think Medicaid, the uniqueness of Medicaid is the concentrated population of people that have very complex needs. And we might differ on the role of social determinants of health, but you can't think about how to effectively provide care for individuals without thinking about what those factors are at the community level that might impact their access or their ability for someone to focus on their health outcomes. So I think around behavioral health, it's always been a challenge. It's a challenge in any healthcare system, whether it's commercial, whether it's private pay, whether it's Medicare. But in the world of Medicaid, we've seen tons of innovation. I think early days, Shahid, we saw quite a bifurcated system of care. You had people who had a diagnosis of a behavioral health need, somebody who had severe or persistent mental illness, and immediately they were identified for their behavioral health needs. And in many parts of the system, their physical health needs were not addressed at all. So I think over the last several decades, systems have really been working to focus on whole person care. It's not good enough to just address behavioral health need. We need to address whatever needs you have in addition. I think we've seen an explosion of digital health. And I think it works effectively in Medicaid. There are solutions that have been brought to market that are really they're really excelling in the Medicaid space compared to what they've been the adoption and success in other types of care. So I think we've also seen non-traditional supports. We've seen expansion of peer support. We know individuals that have substance use disorders, individuals with behavioral health needs, they really fare well having somebody who can help them navigate the system and somebody who has lived experience. We've talked about, I know we'll talk more about telehealth. I think telehealth, during our experience with COVID, we saw really shining light on the epidemic around social isolation and loneliness. And we've seen tools that have been designed and executed to just address those types of needs. So it's a great time to be in Medicaid. I've been in this business a long time. Deep passion about individuals who access the system. And if you think about it, and I always tell people, if you think about Medicaid, you probably know somebody who's been in Medicaid, somebody who's currently in Medicaid, and we all ourselves are one catastrophic event. We're one diagnosis from Medicaid being our system of healthcare. And for those reasons, the individuals in Medicaid deserve to have a top-notch healthcare system. So I think we've seen, and I know we'll delve into this more, but just adoption of digital health, it's just exploded. And I'll say those of us that have been in Medicaid a long time, it felt pretty basic and pretty general for many, many years. And then all of a sudden, it was like, boom, we can do this, we can do that, we can use AI, we can use iChat robots, we can do all of these things that really are moving the needle. And so post-COVID, I'd say it's a time where health plans with loss of membership and other challenges around just premiums, they're really having to get creative about what the system of healthcare looks like. Gone are the days of just having a directory of physicians and specialists that you can see. Now it's really about getting in there early, identifying what pathways to care work best for people, and then providing a variety of tools and supports that can meet people where they are.
Yeah, Gary, I love the way that you introduced this topic, and you use a couple of key words that I want to just comment on a little bit. And you said Medicaid, which is of course, a government program, and then you use words like innovation and creativity, which don't usually go with government programs like this. And so let's start there for just 1 second and say, when you think about innovation and creativity, how do we reframe mental health, maybe not just as a health issue? Because really what you and I were mentioning in terms of saying social determinants of health, it's not that I don't think that's important. It is super, super important.
I know you do.
The question is, how do we kind of reframe it? Because it's not a healthcare issue, it's a life care issue. So as a community and societal issue, what could we do with Medicaid to help them reframe this entirely?
Yeah, I've spent a lot of time in this space, and I've seen so much change over the years and how people. I mean, let's just start with the stigma around Medicaid. There was a time where people would not even want to acknowledge that Medicaid was their system of care. And there was a time where providers were not even interested in participating in Medicaid. And so I think we've done a lot. You think about Medicaid and you think about the associated stigma around behavioral health equally. There are so many people who either would not self-identify or would not even access care because of the stigma and the challenges associated with accessing care. So I think Medicaid systems, we've learned a lot over the years, and certainly part of that is listening to our members and understanding how they access care. And so I talk about the early days of Medicaid before managed care was prominent, that it was like you got a hunting license and you either hunting for care or you were a hunter and gatherer and you were looking for care. And nobody was manning the store. We had data around claims data, so we could see who was accessing care. We knew a lot of people were using the ER as their primary care provider. None of that is an effective way to create a foundation to provide care, especially focusing on outcomes. And I think with the expansion of managed care, I've managed healthcare systems before they were in managed care and after managed care. And the one thing I would say, whether you're a fan of managed care or not, I think states need one neck to squeeze. They need to have one organization that can be responsible for the coordination and access of care. When you have 100 different people engaged in trying to coordinate care, it doesn't work out so well. And so I think managed care has really provided a pathway for states to really focus on innovation. They've upped their game. They've created complex standards. They've created report cards. They've created quality measures. They've created all of this oversight. that allows these managed care organizations to demonstrate their ability and their value. And when you think of social determinants of health, it's kind of like the shiny thing that we've been solving for community needs from the beginning of time. And you know this, Shahid, as well. But what happened was we got to a place where immediately we started thinking, maybe there's some truth in the fact that if you have somebody who has a severe persistent mental illness, and guess what? They're homeless because their condition is one that they're not receiving proper care. They're not on any type of medication adherent. Then guess what? It affects their housing. Nobody will allow them to live anywhere. So then they become homeless. So then you've got a health plan trying to find individuals who live in a bridge or who are living in kinship care and moving from couch to couch. They're no better than when you found them. And so I think we began to focus on what are the things around social determinants. We may not be able to change everything, and we know so much of this might be tied directly to the street you live on or the zip code you live in. But if we figure out that those drivers, what we call non-medical drivers or social determinants of health, if you have a food insecurity, if you have lack of transportation, if you have lack of employment, which might include employment assistance and housing, if you have lack of housing, then God forbid anybody is going to be able to effectively manage your health care. And I think what we've seen is it's not one or the other, it's actually how they work together. So if we can get somebody access to care, and whether that be you're in a rural area and there is no provider who's going to see you with the exception of telehealth, then that is success. But along those same lines, seeing a doctor, having regular appointments, having a regular connection with somebody who focuses on both sides of your health, whether it be your mental health or whether it be post-substance use disorder or whether it be just diabetes management, that's step one. And then we figure out what are all of those related factors. Are you a caregiver? You burned out. You're trying to take care of kids and aging parents at the same time. So your care goes on the wayside. Whatever that is, we have figured out, and we're still perfecting it because there's no perfect healthcare system. What we've learned is those drivers can really predict what outcomes look like for individuals. And if I can figure out what are those motivating factors, for example, if you lack transportation, and so the only time you ever see a doctor is when you get so bad that you get somebody to drop you off in an emergency room, then we know we have failed you. If you're somebody who has a food insecurity and your number one issue is you have nothing to eat, then how in the world can we assume you're going to manage an A1C, that you're going to be checking your blood sugar and managing your diabetes? I mean, it's just those types of factors that I think have really educated all of us in this business, that it's all of those things collectively that actually make the difference. And I know I'm preaching, but I'm super passionate about these areas.
No, it's not preaching at all. I think getting everybody to understand the totality of life's circumstances is what determines our health, right? It's not a physical ailment only or a mental health ailment only. It's our environment, plus our body, plus our genetics, et cetera. And it's fantastic to see that Medicaid is starting to think about that. You mentioned that digital health has been moving rapidly within the Medicaid community. But we still have these issues of internet connectivity in rural areas. You also mentioned that rural health is a major part of what Medicaid is trying to focus on. Catch us up a little bit on what is the infrastructure availability of digital health tooling in things like internet or other areas that make Medicaid either successful or not as successful as it could be.
Yeah, I think when you think about access, there are lots of factors to consider. States have been themselves focusing on expansion of internet capabilities across communities. That was brought to us. We saw that in COVID. We had schools that were teaching over the internet. And what we found is the infrastructure did not meet the needs of most individuals that needed to support them. So we've seen digital tools that don't run on the internet. We've seen digital tools that run on a smartphone. We've seen heavy adoption of smartphone use. And despite the, people that will say, well, we can't imagine most people in Medicaid have a phone, a smartphone. Well, in fact, they do. And in fact, lots of health plans actually, to stabilize their members, provide them with access to a smartphone. Some provide internet access because it's all about how we're going to ensure access to care for these individuals. So we've seen even outside of healthcare, we've seen really broad efforts around expanding connectivity efforts to the internet. We've seen digital tools that are tied to your TV. They're not even tied to internet. They're tied to, tapping into your TV and using the TV as a platform. We've seen so many different types of solutions that it can be exhausting. If you're trying to understand all of these pieces, there are so many, and there's new ones every day. You go to the health conference in Vegas and you walk through there and you're just like, holy cow. There's hundreds of solutions. You meet these entrepreneurs. So many of them have a lived experience, or they've created the solution to solve for something they've seen. We've had the privilege of supporting a number of these organizations, and I'll tell you, at first glance, having been an old dog trying to learn new tricks, I see these and I say, how in the world is that going to make a difference? And I am, I will say, I've been surprised a couple of times. Now my eyes are wide open. So anything that seems like, I don't know if this would work, I just assume, it probably will. Because I have learned through this process that these types of solutions, sometimes based on the most simplistic approach, and sometimes that appear to have the most simplistic approach, that have the smartest engines running behind them. It's just amazing, the explosion of digital health tools. And what's most amazing, and we shouldn't be surprised, is how much people are really focusing on self-care. And they're using these tools. You look at substance use, there are solutions that create virtual support groups. They're connected to hundreds of people that are struggling with the same challenges they are, instantly connected to friends, people who they would never have known, and people who something about they would never even want to tell anyone about. And instantly they have access to this support group, people who addressing social isolation and loneliness, people who are accessing care. It's amazing. And I won't mention the company because, I don't want to make a plug for anybody in particular because there's so many great ones, but a company that I first saw that I thought, how is this really going to work? And it was an iBot that you interface with, and then it identified or triggered when there might be something else you need. What was so fascinating about that solution is that the peak time for people to use that benefit was between 2 and 5 in the morning. And those are times of the day, there is nobody at a health plan who's going to take your call. There is no service coordinator who's going to wake up with you and help address your need. And so I think we're seeing this explosion of tools that say, hey, whatever you need, whenever you need it, and however you want it, we've got something for you.
Excellent. If you're just tuning in, you are listening to Healthcare Now Radio. This is Trending Now, and I'm Shahid Shah, talking to Gary Jessee at Sellers Dorsey. We're discussing the transformation of Medicaid through digital health innovations and its crucial role in advancing health equity. You've taught us a lot over the last 15 minutes or so, Gary, about some unobvious things. And I want to especially highlight 2 key points. One is you mentioned that we often will say, well, this app or this digital tool will not work for Medicaid without any research behind it, right? And I think you're telling us, hey, at least try it out, or at least go look up the research. And the other part is self-care. I love that you mentioned that people are not always looking for someone else to do the work for them. They're just looking for a tool, a technology, a capability that would let them do it for themselves or for their family. We do live in America. We are libertarians by nature, and we love for us to have lots and lots of freedom. And so any technology that offers that kind of freedom in a place of having for you to talk to a person, et cetera, is often quite useful. Do you want to elaborate on that a little bit? Is why do we think that the, quote, poorer the community or less access that they might have, that they somehow need more human-only help? How could we differentiate and make that better here with the digital tools available?
Yeah, I think when you think of traditional healthcare, you think of a relationship between an individual and a provider. And if there were enough providers, nobody in their right mind would suggest you would disrupt that. But if you are somebody who is trying to access psychiatric supports, if you're somebody who's trying to access a behavioral health specialist, you're trying to navigate what insurance you have, who's in your network, and then you're told it's going to take you 6 months to get an appointment. What are you going to do? Like, what is an individual going to do for those 6 months? So I think what we've learned from experience, and then just to complicate that, you're in the middle of nowhere. We don't force people to live where we think they should live. We allow people to live where they want to live. And so if you're trying to coordinate care for somebody and they happen to live in Podunk community, and there's nothing there, despite the fact they may not even have a rural hospital anymore because it might have closed. So what do? If you're one of those individuals, you still deserve access to care and you deserve timely access to care. So we're seeing things like digital health. There's people who will argue a relationship over telehealth is not ideal. And I agree with you. Telehealth is not a solution for every diagnosis, every condition. But if you have a basic need, and I always tell the story like this. If you're a mom and you have 5 kids, and every time one of those kids gets sick, you don't have a car, and you've got to get on the bus with 5 kids to travel across the city to sit in a physician office to get an appointment. You know how disruptive that is to your day. And to think that these individuals now might have access immediately to a telehealth consult, one, reduces the need to go to a hospital. Two, quickly addresses the need of the individual and the person they're caring for. Boom. And then you move forward. Now, that may not be the same. If you're diagnosed with cancer or you have some serious behavioral health issue, nobody's going to replace the need for you to have a regular ongoing dialogue with a specialist. But let's be real clear. If you have access to telehealth, that is a major improvement in our healthcare system. And quite frankly, and I can't speak for you, I've used telehealth repeatedly, so much so that sometimes I feel like, gosh, this is so much easier than trying to schedule time and making sure I'm in town that day and traveling to the doctor and then going to the lab. I mean, all of those things that happen, it creates access to care, immediate access. And then the other thing I'd say around that is these digital health solutions, and I like to refer them as digital tools. Everybody approaches care in different ways. And it doesn't mean that there's a one size fits all for any of these. But if they can make a difference in somebody's life, and they ultimately are ensuring that people are getting the right care at the right time, and then one step further, that they are avoiding unnecessary acute care utilization because they have these solutions, then they should have them, and they should have had them longer than we have them. So I just say one of the challenges around digital health has been the speed and the pathway for these entrepreneurs to be able to fit into a clunky regulated healthcare system. And a lot of Medicaid directors, including myself, we had to do a lot in our former roles to be able to create a regulatory pathway where these organizations could exist, where they could actually be reflected in a medical spend for a managed care organization, in terms of MLR, that they were not an administrative cost, that they really did improve outcomes. The other thing that we've seen is sophistication around these tools. The return on investment that these entrepreneurs are calculating and documenting, it is so impressive. I mean, so much so that when you look at independent studies by some of these digital health tools, they're moving the cost curve by 11% in premiums. You think of a health plan that's receiving a premium, and month after month, they have this outlay of care. And then you think about the opportunity for those individuals to be able to save those dollars and reinvest them in different ways. That's critical to success.
Absolutely. And I love that last part, especially, is that the ROI is so good that you almost have to try these things out. You can't just say that, it's a government program and it wouldn't work. I'm glad to hear that the Medicaid directors have cleared out a lot of these pathways so that, especially the startups that are listening to this conversation, often we're told, don't go after government dollars. Well, in this case, you're not actually going after government dollars. You're using your entrepreneurship capabilities to go after health plans who are getting money from government dollars.
Exactly. Yeah, there's the stigma. I meet entrepreneurs and they're like, yeah, we were told, figure out all the other payers And then if you have a stomach for it, try to navigate Medicaid. And I say to them, it's quite unfortunate, because if you think about it, if you've got a solution to bring to bear on a specific population, and you've got a healthcare system where aggregated, you've got the largest incident of this type of need, then why would you not start with Medicaid? Like, we need it the most. So I have personally talked to lots of entrepreneurs, and I encourage them. It's not, any new solution, nobody wants to be the first to try it out. That's the other thing you deal with. But we need you in Medicaid, and we want you in Medicaid. And so for that reason, we have to figure out how to make it work for everyone.
That is excellent advice, and it's especially for startups who are also looking for sales. And if you can get sales from this community, definitely take it. So in the last minute or so that we have left, what I'd love to talk about is that there's a dependence now with providers being told to work with communities and community care, social care networks, Gary. So what do you advise plans to do? Are community-based initiatives being overworked now? In fact, they were overlooked before, but now are you depending too much on them? How do you mix that in the last couple of minutes that we have with the health plans? What do you tell them?
I really like this question a lot, because I think for a long time, Medicaid system said, we focus on the things we pay for, and then, you figure out the rest. And then we realized it doesn't work. We have to focus on whole person, in some cases, whole family. So there has been this important shift where states are requiring their managed care organizations have to think about those things that are not even part of their capitation. Like, we need you to connect them to community supports. We want you to have relationships with community partners. We've seen consistent investment in community partners, which tells you that managed care organizations know who are these community partners that are moving the needle in care for their members. My one hesitation around this, having managed the system in a lot of different ways, is that without having a true partnership with community service partners, then what you're probably doing is you're creating a capacity challenge. If I simply refer everyone that comes to me to a community organization that I really don't work with very well, then chances are, when they get to that partner, they're going to get told, we have a waiting list, or we have no capacity, and I'm not sure why they sent them to you. So to me, effective coordination is, if we're all doing our part, then I should have a meaningful relationship with you as a community partner. It should be very clear what those referral protocols look like. Should also help me identify escalation provisions. If I send you this person, I should let you know they're at the end of their rope, and they might need to go to the front of the line. But without having those clear processes, then we're just really limiting capacity.
Got it. And that was a perfect way of concluding here. We have a lot more to discuss, and hopefully, Gary, you'll join us in a future episode, because this was just fantastic advice. To our listeners, thank you for joining us on Trending Now, especially I wanted to thank Gary and his team over at Sellers Dorsey. You're listening to Healthcare Now Radio. Stay tuned for more episodes where we explore the latest trends and innovations shaping healthcare's future. Thank you so much, Gary.
Thank you.